Hello everyone, welcome back to another video on Elite Academy. And today again we are going to discuss one very important issue as part of our daily issue analysis DIA. And today whatever we are going to discuss is one of the perennial issue and it is very common. Still we don't have proper data or sometimes we miss analysis arguments. So we'll see what is the topic today. Okay, let's start. So today we are going to discuss about public health system. So public health system, if we analyze first what is health, then the meaning of health has two parts. One is the subjective aspect, which includes physical health, mental health, and social well-being. And on the other hand, objectively, if we analyze, it means absence of disease validated with evidence. So we should have evidence that we are not having any kind of disease. That is objectivity. But subjectively, it includes everything: physical well-being, mental well-being, and social well-being. So this is the meaning of health. You can use it for your introduction and analysis. Now we will analyze with the help of certain data what is the status of public health system in India. So the first data which comes handy for us is that we have low public spending on healthcare. At present, it is 1.3% of GDP and it is lowest among the BRICS country. So we have already discussed about BRICS. We have a video, dia video on BRICS. So this spending is lowest in BRICS, that is 1.3% of GDP. However, the global average is 3%. But if we talk about our national health policy to 2017, it also mentions that the public spending on the healthcare should be 2.5% of GDP. Not only that, Niti Aayog a few years back they recommended that the public health expenditure on education should be 6% and on the public health it should be somewhere around 4%. So neither according to the Niti Aayog recommendations, nor according to global average, nor according to national health policy, we are spending. So this is not matching at all. At present, it is 1.3% of GDP. Next analysis, next data, we will take the help of out-of-pocket expenditure. So if you want to analyze, these are the issues. You can put it as a side heading and you can say, okay, these are the issues in our public health system. And they are. Okay. So this is out-of-pocket expenditure OOP. In India, it is at present nearly 66%, and global average is 18 to 20%. So this is the status of out-of-pocket expenditure. If we analyze preventive versus curative care, Niti Aayog told that we should focus more on preventive care than curative care. In global at global level, countries are spending more in preventive so that the burden on the tertiary care, secondary health care should be less. And if we are investing more on preventive care, then logically less people will fall ill or diseases will be less. So the burden on the health infrastructure will be less. So we should more in preventive care. But in India, it is exactly opposite. We are spending more in curative and less in preventive. So out of the total current expenditure on health, we are just spending 6.7% of the total expenditure on health in preventive care. So you have facts to substantiate your argument and analysis. Next is according to Niti Aayog, doctor is to population ratio as of 2017. So this data is of 2017 is 1 is to 1613. So 1600 लोगों पे एक डॉक्टर है. So 1600 people we have one doctor. Next data is related to nurse is to population ratio. So for 588 people we have one nurse. So current nurse population ratio is this. Now you tell me if we have these data of spending, out of pocket expenditure, preventive care, doctors to population, nurses to population. So how we can have a reliable health infrastructure? Definitely burden is more. And we saw what happened during COVID times. However, the COVID time was an extraordinary time. So we should not compare with that. But still, the status is not very good. Okay. So these are the issues or this is the status rather. However, you can use it as issue and analyze. Now we will discuss other aspects of the public health system. So what we have done, we have taken public health system and we will analyze the public health system and related issues and solution under four head. We'll see. The first one is the primary health care, nutrition, like that we have discussed. So in successive slides, we will discuss about it. So first we are starting with the primary health care. So the first line which is written that why primary health care is important. primary healthcare is important because of the it can lead to better health outcomes. It is the key enabler of higher life expectancy, better health outcomes, and thus it leads to lower cost for the expenditure on the healthcare or health services, and it is preempt need for secondary and tertiary care. So this is the importance of primary healthcare. So whenever you want to write, you can use it these analysis, these points for your introduction. Next is related to the issues we will discuss. So the first issue itself is capacity constraints. So capacity constraints, why it is there, and whenever we are analyzing capacity constraints, we will analyze from two point of views. One is with respect to equipments, availability of equipment. So poorly equipped, the primary health centers, they are poorly equipped. Sometimes they don't have even the basic services like toilets, separate toilets for women. They don't have even weighing machines sometimes, so they are poorly equipped, and most of the times there will be no doctors in the primary health centers all the time. They will be not available. So there are reasons behind it, because generally these primary health centers, they are there in urban places definitely, but when they are located in rural areas, remote areas, or some far away areas, so doctors, they will have less motivation to go and serve in those areas because of lack of infrastructure, facilities are not there. Also, the paying capacity of the people, of the citizens in urban areas will be more in comparison to the rural areas, so that is another problem. So they lack motivation to go and serve in the rural areas. So there is lack of motivation, poor infrastructure is there, paying capacity is less. So that's why it is leading to that less number of doctors are there and serving in the primary healthcare in the rural areas or in the remote areas. So this is a capacity constraints with respect to primary healthcare. Second issue is related to funding. So funding constraint is also there. We know that government has come up with 1,50,000 sub centers which has been converted into health and wellness centers, but low funding is there, poor sanctioning is there. Okay, so even though it was announced in the budget speech in 2017, and as it was enshrined in the national health policy 2017, but funding is inadequate, leading to low spending. Already we have seen that hardly 1.5% of gdp is being spent on overall in the healthcare. Now just imagine how much would be going, or how much would be dedicated for primary health care. So health and wellness center, whenever we are talking, it has been announced, but funding is low. When funding will be low, then what will be there? It will lead to out of pocket expenditure for the people. So citizens have to incur the high out of pocket expenditure, which we have analyzed, that too in case of primary health care. Okay. And most of the out of pocket expenditure is going on drugs, because the primary health cares are not providing drugs. So they will recommend, and people have to go and buy from outside. So this is a funding constraint leading to out of pocket expenditure and compromise with the PHCs. Next issue is related to supply side constraint. So supply side constraint we will analyze from two point of view. One is related to personnel, and second is with respect to services. So supply side, there is less supply of trained and motivated personnel, which we have already discussed that why why it is happening. Lack of motivation, poor paying capacity, lack of infrastructure, lack of equipment. So infrastructure, everything will be covered. So trained and motivated personnel are less, and they lack skill, they lack appropriate training, and supportive supervision of health workers is not there. Okay, so this is the supply side constraint. Also, we have poor quality of services. We have discussed that poor quality of services is there because they are poorly equipped. Sometimes they don't have sufficient. Now we know that in rural areas we have more old age population, because this is a social problem we are analyzing, that how it is, how migration is happening. So mostly in rural areas, old age people are there, so senior citizens are there. So there is these PSC, they are hardly equipped with geriatric care or palliative care. So such kind of cares are also missing. So this overall, this way we can summarize that. Okay, what are the challenges at the primary health care? Okay, now we'll see other things. Now we will discuss about the primary health care, definitely we will discuss, but now we will discuss about the solution. So what we are going to do today we are discussing the problems and way forward simultaneously. First we have discussed about the problems, now we are going to discuss about the solution. So we have discussed about the health and wellness centers. They have to be established according to the national health policy also. Okay, so we need to accelerate this health and wellness center. We have this target of developing a network of 1,50,000 health and wellness centers. So we need to expand, we need to accelerate that establishment. So this is one. You talk about that how these health and wellness centers should be equipped to screen and manage the non-communicable diseases. They should be able to screen and manage the mental health related issues. They should have these services related to dental, ENT, geriatric, or palliative care. Okay, so if they are even trauma care and emergency care, so if they are able to manage that, then there will be less load on the secondary and tertiary care. Okay, so this is another way forward. Next, we can talk about a rapid scaling up of the training. So rapid scaling up of trained personnel should be there. So this is why National Health Policy 2017 is also precisely talking about health cadre management separate, so that they can be trained and equipped in order to manage everything, be it palliative, geriatric, or ENT, mental health, understanding the science of the depression or mental health related issues. So we need to train people so that then only we can post them, we can they can be sent to the primary health care. Okay, so scaling is needed in terms of training. Next is related to catalyzing people's participation. We need to catalyze healthy people's participation. Okay, why it is important? It is important because when it will be people driven, then it will be more demanding and it will be more appropriate. So what is happening with respect to social audit or in MG Narega or Swachh Bharat Abhiyan, where people are directly involved? So okay, we need to catalyze people's participation also. That can be very important tool of preventive healthcare, and that's why precisely we have Swasth Bharat Jan Andolan. Okay, so this is very important. Next is related to coordination. So we need to have a very good coordination of health and wellness centers, village health and sanitation society, PRIs, CSOs. We need to divert funds from this CSR activities. CSR activities should invest money in this what we are talking about primary health centers. Yes, so we need to mobilize corporate social responsibility and arise funding also to the health and wellness centers. So this is how you need to think about the way forward whenever you are discussing and analyzing the issues. Okay, so let's analyze the other category of issues. The next category of problems which we are going to analyze under public health system is related to human resource. So the issues are related to personal shortage. So personal shortage we have already seen in the starting on the starting slide itself about doctor is to population ratio, which was 1 is to 1 1600 1613, and with also the nurse is to population ratio was 1 is to 1 588. So this was the data which we have already seen. Also, we have skewed distribution. So skewed distribution in the sense that availability of doctor in southern India is good in comparison to the northern India. Not only that, if we analyze within region also, then rural India is having shortage of shortage of personals, but urban areas having good number of personals, be it doctor or nurses. So personal shortage is not there in urban areas. So this is one of the aspect. Other issue is related to allied health professionals and specialists, or you talk about paramedicals. So paramedics, the distribution is uneven. Medical and nursing colleges are also uneven. So that is with respect to why there is less supply of allied health professionals or specialists, or for that matter doctors. So be it the lab technicians or optometrist or radiologist, there is shortage of these allied health professional and specialists. So that is there, be it North India versus South India, within region or in general also. Next issue is related to regulatory system. So Medical Council of India, we know, is the regulator for this doctor as a practice, which regulates the practicing of the doctors. So Medical Council of India, we have already seen that how they were involved in corruption few years back. Even the chairman of the Medical Council of India was involved in corruption. So what kind of regulation we can expect from them? Not only that, we have Nursing Council of India is there, but they have failed to ensure adequate availability or quality of health professionals. So these doctors who will be given license by Indian Medical Council, they also do their private practices. So it is like sometimes it is conflict of interest. Also, if you have seen long back the episode by in Satyameva Jayate by Amir Khan, so there also it was highlighted well that how these doctors they indulge in sometimes a kidney transplant, illegal kidney transplant, selling of those kidneys. Not only that, basin test was highlighted by the in Satyameva Jayate that how these private practitioners, the doctors, they recommend certain the test lab test which is not even required, and they have some collusive understanding with the this path labs, so that they will write and they will also generate report without doing the actual test, and they will just take the blood and they will throw it in the basin. That's why it was known as basin test. So it was well highlighted in the Satyameva Jayate. So that is the status of our regulatory system. Okay. Next issue is related to training and capacity building. So training and capacity building, we know there is poor infrastructure in colleges. So there is a divide of college North India versus South India. There is poor availability of medical colleges. The cost, the fee is very costly. It is not affordable. Lack of specialists and super specialists are there, be it oncologist in India, or even the COVID scenario has highlighted the status of epidemiologist in India. So everything, there is shortage of doctors, and the super specialist doctors there is shortage. And it has been also found that we don't have any comprehensive HRH policy, that is human resource and health policy. We don't know the health professionals, how much we need in the future, what is the status in India. So we don't have comprehensive data, so there is lack of data in HRH in the country, related to HRH in the country. So we don't have any projection studies that how much we need in particular sector, how much we need in coming years. So that's why we are, if we don't have data, then how we will train them, and how we will worry about the capacity. So these are the issues related to human resource in the public health system. Now we'll see the way forward related to human resource. So we have discussed about the problems in the human resources. Now we will discuss the way forward. So first way forward which is required is we need to update the curriculum with the changing dynamics. So we know that our society is in transition, migration is happening. So rural areas have different requirement, different age group people are living, staying in that area. Urban areas have different requirement. So, and not only that, the current scenario 2 years back we have seen that how different types of viruses are coming up. So we need to update the curriculum according to the changing dynamics of the public health policy, according to the demography, upcoming futuristic problems. So we need to anticipate, and accordingly we need to update the curriculum. So this is one aspect. Second is related to we need to incentivize and motivate the professionals through attractive salaries, benefits, perks, allowances, or for that matter, infrastructure as well. So I will share one of my experience that government has this facility of central CGHS scheme, central government health scheme. So there are many doctors in the private. So empanelment happens. So government will empanel certain hospitals, and then the government officials they can go and they can avail the services and benefits. But there are certain departments where the doctors are denying that they will not see the patients under CGHS. Why? Because they are government pays them very less. For one consultation, they pay government is paying them 125 rupees, 100 rupees. So now you only tell the people who are there in urban areas, the doctors who are there in urban areas, and that too when they are in a private hospital. So even though the hospital is impaneled, if they don't have any incentive because attractive salaries or attractive remuneration is not being given by the government. So we need to provide right incentives and right set of motivation to them. Okay. Next is related to comprehensive HRH policy should be there. Human resource and health policy should be there, be it with respect to recruitment, retention of the professionals, posting in difficult areas. So that should be there. Otherwise, we will have always shortage of the officials. We need to address this shortage. So we need to have a comprehensive HRH policy. Also, next is that we need to engage private sector for skilling and training in HRH, because we have seen that how private sector hospitals, they have a right set of people, they are equipped, they are motivated, they are trained to handle different kind of scenarios, and especially when it comes to mental health or palliative care or geriatric care. So there we need to engage private players in skilling and training the HRHL. Also, when we were discussing about updating the curriculum, so we need to change it, keeping in mind the shift towards increasing awareness towards palliative care, geriatric care, or mental health. So this way, you link it. Next, what we can do, we need to increase the specialist and super specialist. So when we are seeing that oncologist shortage is there or epidemiologist shortage is there, and that too in the changing scenarios nowadays, diseases are coming up with this nature where we need a super specialist and a specialist only. The general doctor, general physician cannot help. At the end, we need to have super specialist only. So we need to increase the availability of those specialist and super specialist human resource. So this is way forward. Next, we will understand the different issue under different head. Let's have a look. Next problem which we are going to analyze in under public health system is related to health coverage. So the first point is inadequate focus. The focus on comprehensive preventive care is not there, and primary care is not there. So we have already discussed the issues related to preventive care. So more focus is on curative care. We have already our data that how whatever total expenditure is there on the healthcare expenditure is there. So out of that, only 6.7% is being spent on the preventive healthcare. So inadequate focus is there with respect to health coverage also, and that is very bad because it is increasing the burden on the tertiary and secondary care. Okay, secondary and tertiary care. So this is problematic. Also related to inadequate coverage. So we know that the various government sponsored insurance schemes are there, or even we also go for a private insurance scheme, but it is very fragmented with respect to the risk pool. So fragmentation of risk pool is there. Not everything is covered. Not all the diseases are covered, and the coverage is also limited to hospitalization. OPD is not covered, drugs is not covered, diagnostic is not covered. So sometimes people will delay visiting the healthcare centers, and they will only go when the situation will be very bad, and they will just go for hospitalization. So it is also leading to problem. Okay, so inadequate coverage is there, and that amount is very less. The as I told you, that outpatient care, drugs, diagnostics, they are not covered under several government insurance schemes. So delay seeking care is happening. Okay, inadequate ceiling. So we have RSBY, that is Rashtriya Swasthya Bima Yojana. Under that, inadequate ceiling is there. If we talk about prices, also the diagnostic test can vary widely across the country. For example, the lipid profile in some states can cost you rupees 90 in some cities or some areas, and it can vary up to rupees 7,000 in others. So this inadequate ceiling is there, which is leading to price variation also. So these are the problems related to health coverage. Now we will analyze the solutions or the way forward related to it. With respect to the way forward of this particular issue, whatever issues we have discussed under health coverage, the first point which we should remember is autonomy to public hospitals to use claim money should be given. So we know that a lot of restriction would be there whenever government is releasing money. So a lot of restriction will be there where you can use, where you cannot use. So there is no discretion. So if we give some amount of autonomy to public hospitals to use claim money generated under schemes like Pradhan Mantri J, that is JAY, okay, to improve facilities or purchase the necessary drugs, test, and to provide performance based incentives to staff, then it will be beneficial. They will have at least some motivation that okay, they can use, they have autonomy to use their public health, the money to somewhere else. The second issue, the second way forward you can write is with respect to the access to affordable drugs and medical devices should be there. For now, these devices are not affordable and they're not accessible also. So we have this DPCO, that is drug price control order should be there. So a new DPCO is required. We need to revise it and to ensure rational drug prices by reducing the trade margins. So if you remember a few years back, the stents, they were very costly and they were not affordable. So DPCO, they intervened and this fresh order was released, and stents prices were later they were affordable. So like this, we need to revise the DPCO, that is drug price control order. The third way forward you can write is with respect to use of technology. Be maybe it will be e-pharmacy or e-sanjeevani. Basically, we need to rope in the technology facilities in order to provide telemedicine and benefits services. Okay, so here the technology can be provide very good linkage to bridge the gaps between haves and have nots, or to provide the telemedicine facilities in the remote areas. And recently one app has been also launched where you can consult the doctor over using your mobile phone through apps. So such services should come up more in order to bridge the gap. Next is related to improve access to diagnostic facilities. So this is also important because if screening is not done properly, if diagnosis is not done properly, then again it is going to create burden on the secondary and tertiary sector, and it will be burden for the person who is suffering also. So we need to improve the accessibility of diagnostic facilities as well for timely discovery and screening of the diseases. Now, the last analysis which we will do related to public health system is under nutrition. So this is also very important because in India we are facing the problem of undernutrition and overnutrition both. And undernutrition is primary risk factor, and that is more than 40% of the under 5 children are deaths are happening because of undernutrition. Okay, so children with undernutrition, be it anemia or iodine deficiency, what will happen? Such children will have low IQ scores and productivity in future will be less. So this is very important because we are talking about our future generation. So we need to provide sufficient nutrition, because then only the overall disease burden will be less in the country. And nowadays we are facing different kind of problems due to undernutrition and overnutrition, challenges of diabetes or cardiovascular disease. Overall, the disease burden will increase. So this is one aspect of nutrition. Next is, because of this undernutrition or overnutrition, it has its own economic consequences also. So World Bank study highlighted this estimate says that reducing stunting can raise India's GDP by 4 to 11%. Because if you remember, few days back we have discussed about the economic survey data, that how they analyzed that because of this open defecation is leading to a kind of disease where nutrition absorption is not happening in the stomach, and that's why it is leading to poor cognitive development. And thus the government needs to invest more on teachers so that they can train such children properly. So this is one aspect, only one aspect with respect to education economic survey has highlighted. If we analyze with respect to health and disease burden, then other challenges would be there, out of pocket expenditure would be there, so many challenges are there. So World Bank estimate is saying that if we reduce stunting, then India can raise its GDP by 4 to 11%. So it has its economic consequences also. Next is with respect to comparative standing. If we analyze, so comparative standing, if we analyze with respect to Brazil, then we have NFHS4 data for India. So NFHS4, that is National Family Health Survey 4 data, that is from 2015 and 16. It says that one third of all under 5 children are stunted. Stunting means low height for age. Also, more than 50% of the children are anemic. So if that one is under 5, one third of all under 5 children are stunted, and more than 50% children are anemic. So have one or two data to substantiate your point. There is another data with respect to wastage. So every fifth child is wasted, that is weight for height, low weight for height. So this data you can analyze from India. But when you compare it with emerging economies like Brazil or China, the story is different. So stunting in Brazil is 6.1%, wasting is 1.6%. So 6.1 is stunting, wasting 1.6. If we analyze the data from China, stunting is 6.8%, wasting is 2.1%. So I have this comparative analysis of data from Brazil, China, or Mexico. So they are doing far better on nutrition indicators when we compare them with India. So these are the problems which you need to highlight whenever you are talking about nutrition. Now let's analyze the way forward. In the way forward, whenever you are talking about nutrition, the first point you should write about is one health concept. Means nutrition, drinking, water, sanitation, everything is interrelated. So we should focus on one health because everything is interrelated, and focus should be given adequately on all. Thus the overall health, the disease burden will reduce. Okay, next you talk about ICDS. So ICDS is very old scheme which is going on, that is integrated child development services, but we have its own limitation, the related to quality, staffing, uh, pilferage, leakages. So there is no social audit on the lines of MG Narega. We should have, or midday meal scheme, we should have social audit of this as well, so that this improved monitoring or improved staffing will check pilferage and the quality. फिर insects नहीं पाए जाएंगे जो कीड़े मकोड़े मिलते हैं food grains में, that will not happen. Okay, so quality has to be focused upon. Then we talk about Poshan Abhiyan, which has been launched by government. So greater flexibility should be given to the states, and it should be implemented on mission mode, especially in high burden districts, so that it will give due benefit to the people or to the areas which are in need. Next, you have to talk about focus on increasing immunization coverage. So, immunization coverage with respect to various diseases, be it rotavirus or pneumococcal vaccines, there is shortage, and there are uh, certain focus districts where vaccination is less. So, we need to increase the immunization coverage in such areas. Also, talk about fortified food grains, biofortification in order to handle the micronutrient deficiencies. So, we should this fortified food grains or the double fortified salt should be included in the government programs, be it ICDS, midday meal scheme, or PDS. And we should also explore the biofortification of food of grains in order to manage micronutrient deficiencies. So, whenever you are talking about nutrition, keep these points in mind. Okay, so quickly we will have a glance at what steps government has taken. However, we were discussing it parallelly, the way forward and the government schemes, but let's have a look at quickly. The first step which government has taken is National Health Policy 2017. It has replaced National Health Policy of 2002. So this is one of the step. Next, government has taken Ayushman Bharat step, where the PHCs, they have been renamed as Health and Wellness Center. We have already discussed about it. So 5 lakh for 10 crore households, okay, for secondary and tertiary. So that is also the plan. We have Jan Prime Minister Jan Arogya Pariyojana. The purpose is related to the provisions of the generic medicines. We have other schemes related to Matru Vandana Yojana and Matru Suraksha Yojana. They focus on maternity benefits, nutrition services related to mother and baby, infant, the delivery aspects. So these are the schemes. Now we will discuss the national health policy bit in detail. Rest of the things you must have come across whenever you were reading about these schemes at the level of prelims. So you don't have to know them in detail, just need certain provisions that why they are into picture, why it has been brought by the government. So that's it, that much only it is required for the mains. Now we will discuss about National Health Policy 2017. So, with respect to National Health Policy 2017, what all points we should keep in mind? So, the first point we have to remember is that there has to be shift from sick care to preventive care, and we have already discussed the importance of it. We have analyzed it with the help of data, and it is important because otherwise we know that burden will be more on tertiary and secondary care. The second aspect is related to health and wellness centers. So we know that PHCs now are known as health and wellness centers. So they should be able to provide comprehensive treatment, be it preventive, palliative, geriatric care, or rehabilitative care. So they should be equipped, they should be empowered, trained officials should be there, equipment should be there in order to. So that is the focus of National Health Policy 2017, revamping the health and wellness centers. Public spending should increase to 2.5% of GDP by 2025. So that is the target. We know that at present it is 1.3% of the GDP. Ideally, we have also discussed that 4% according to Niti Aayog. Next is with respect to we should they are targeting national health policy is targeting with respect to life expectancy, IMR or HIV. So the target is that life expectancy should increase to 70 by 2025. IMR should reduce to 28 by 2019 was the target. Okay, and focus on HIV. The 90 is to 90 is to 90 strategy is there. Also, it is talking about mainstreaming the Ayush. So Ayush department now has been introduced. Yoga in schools has been introduced. We have International Yoga Day, which has been recognized and accepted. So mainstreaming of Ayush is one of the agenda of National Health Policy 2017. Also, domestic production of drugs and devices is another agenda, basically promoting make in India of these drugs and devices. There are two, three more points. So, National Health Policy 2017 is also focusing on public health management cadre, a special cadre for health management. It is focusing on yoga in schools. It is focusing on National Digital Health Authority, basically to provide e-health card where all the data about the patients will be in a digital format. It will be available with the doctors, and at any time they can have access of it, and they can, whenever they need the past history, they will have everything. Next is focus on NCD should be increased because non-communicable disease, be it diabetes, cancer, or cardiac related diseases, they are increasing. So the focus should shift to non-communicable diseases also. So these are the few provisions in national health policies which we should keep in mind, and whenever it is coming, don't miss to write these points. So today's video has got lengthy from 25 minutes, average 20 to 25 minutes to 35 minutes, but the issues were very, very important. And after this, I'm very sure that you don't need any kind of analysis, any data, or any substantiation. So don't run after material, revise it again and again. Take the help of the handwritten notes, which we are going to provide in the Telegram channel, and enjoy. Okay, so take care and yeah, revise well. We will meet tomorrow.